More than 9 million deaths every year are attributable to high blood pressure, also known as hypertension. Close to 1 in 3 adults suffer from hypertension worldwide. It increases the risk for heart attacks, strokes, kidney failure, heart failure, and aneurysms. Sounds bad? It is. Among non-infectious diseases, hypertension is likely the largest global health issue of our time. Low and middle-income countries are burdened by a high rate of uncontrolled hypertension and high death rates. But even in high-income countries, hypertension is one of the leading causes of death, and it is getting worse. Causes of hypertension. High blood pressure is not a standalone issue. There are many underlying conditions that contribute to high blood pressure. Many have to do with artery health, more specifically, how well blood vessels are able to dilate to increase blood flow. Others might affect blood viscosity. Hypertensive medication is often designed to improve blood flow by various means, for example by blocking or enhancing biological mechanisms that affect the dilation of blood vessels. Hypertensive medication often has serious side effects, including erectile dysfunction. Metabolic syndrome. Hypertension is one of the conditions used to define the metabolic syndrome. The other conditions are abdominal obesity, high blood lipids, and insulin resistance. These conditions are closely linked with one another, and they are related to life-threatening chronic diseases like heart disease, fatty liver disease, chronic kidney disease, and type 2 diabetes. The progression of these chronic diseases, in turn, often worsens high blood pressure. Ideal blood pressure. The WHO defines hypertension as a systolic blood pressure over 140 mm of mercury and/or a diastolic pressure over 90 mm of mercury. This does not mean that there are no health benefits in further lowering blood pressure. There is strong data to support 130 mm of mercury as the threshold for hypertension, as it is done in the US since 2017. In fact, health benefits might continue down as low as 110/60. Don't be discouraged if you are far away from these numbers. Every step counts. Dropping 20 points might cut your risk for heart attacks and strokes in half. Normal blood pressure. What is the average, the so to say normal blood pressure found in adults? A rough estimate is to calculate 100 plus age. So, in their 20s, people are still close to ideal. In their 30s, the norm is to have elevated blood pressure, and after 40, the norm is to be hypertensive. But this is not inevitable. It is not a consequence of aging. A study in rural Kenya of a mostly plant-based population showed a blood pressure around 120 mm of mercury for young adults, so similar to everywhere else. But this value actually dropped slowly as they got older. Hypertension and salt. One of the measures prescribed against hypertension is to reduce salt intake. The sodium in salt is an essential nutrient, but an excessive intake increases blood pressure in many, and it can damage artery health independent of blood pressure. Salt is commonly used to enhance taste, so it is found in processed foods, even desserts, restaurant food, canned food, and baked goods. Steps to reduce salt intake include not using salt at the table, replacing salt with herbs and spices when cooking, minimizing processed foods, and shopping for food products with less than 100 mg of sodium in 100 grams, or less than 250 mg of salt in 100 grams. Hypertension and meat. Rates of hypertension differ greatly between omnivorous and more plant-based dietary patterns. Eating a meat-free diet cuts the risk for hypertension by about half. Going for a whole food plant-based diet might cut the risk by about 2/3. There are several studies showing that people eating meat-free diets have lower blood pressure on less medication, and they still have lower blood pressure after adjusting for weight. If you suffer from high blood pressure, it might be a good idea to cut meat out of your diet and to focus on eating lots of whole plant foods. Nitric oxide and impotence. An important molecule regulating the dilation of blood vessels is nitric oxide. That's how Viagra works. Nitric oxide relaxes arteries and allows for more blood flow. Thus, it plays a major role in preventing heart attacks, angina pectoris, and, well, erectile dysfunction. Erectile dysfunction is often caused by arteriosclerosis. As arteriosclerosis occurs in all blood vessels, it can manifest in different places, and two common early warning signs are erectile dysfunction and lower back pain. We can support our body's nitric oxide and thus our health and sexual function both in women and men by dietary means. Hypertension and diet. Nitric oxide is attacked by free radicals. To protect the nitric oxide our body produces, we should eat lots of antioxidant-rich fruits and vegetables. We can also help our body to produce more nitric oxide by eating nitrate-rich vegetables. Be careful, added nitrate in cured meat like bacon is harmful. Many green leafy vegetables are rich in nitrates, like arugula, lettuce, kale and spinach. Non-leafy nitrate-rich vegetables include carrots, red beet and broccoli. Eating 3 portions of whole grains a day can lower blood pressure as much as common blood pressure medication, with only good side effects. Bluntly speaking, if you had the choice, would you rather bear the risk of constipation and erectile dysfunction, or eat 3 portions of whole grains daily? We will link a video about whole grains in the description. On an extra note, ground flax seeds have been shown to reduce blood pressure significantly. Thanks for watching our video. Please like the video to help it reach a larger audience. See you next week.